The recent COVID-19 pandemic is an example of how the healthcare system has systematically held Black people back for decades. Black Americans have experienced higher rates of COVID-19 infections and deaths compared to white Americans due to the lack of trust they have in the healthcare system. The essay Healthcare by Janine Interlinie in the 1619 Project uses historical narratives to show how centuries of restraint and neglect to Black communities by the American healthcare system has led to centuries of distrust and lack of resources.
The essay in the 1619 Project outlines how Black Americans have helped shape the United States into the democracy it claims to be and tries to reframe the American mindset on Black history, not as a shameful past, but as an important part of the creation of a true democracy. An example of this is the American healthcare system. The essay covers how after the Civil War there was a mass epidemic of various diseases spread among the newly freed. This was largely ignored by the system, and many thought it was due to a natural extinction of Black Americans. When hospitals were built to house them, they were underfunded and often did not follow correct protocol. This resulted in many unnecessary deaths and outbreaks of disease. Many southern states were against public health care because of the fact that they would have to give care to Black people, and fought the idea of public health care by labeling them as socialist or too expensive to the taxpayer to gain any support from the people. Later in the century, after World War II, job-based health care insurance became common, which gave health care to blue-collar workers. But one of the problems with the system is that it left out most Black people as well as minorities because many of the jobs they held did not offer health care insurance to them. This is one of the many reasons why minorities and people of color suffer disproportionately from poor health due to the systems in place.
The Affordable Health Care Act, which was signed in 2009 by Barack Obama, sought to right many of the wrongs of the old system and help minimize and hopefully eventually get rid of the gap between white and Black Americans in healthcare standards. This act was very controversial back then and still today due to its centralized approach to healthcare that was largely foreign to the American system. Just as the first ideas of public health, the Affordable Health Care Act has been criticized by the same talking points, such as being too socialist, costing too much for the taxpayer, and many more. Many of these criticisms are based on the past and present ideas of denying Black Americans their right to health care and equal treatment.
It's interesting to think about how African Americans have much lower vaccination rates compared to other races. I often wonder if anything is being done to address the long-standing tension and mistrust between the Black community and the healthcare systems. It seems when the reasons for vaccine hesitancy get discussed, the backstory to that mistrust is not usually mentioned. I've always known that the U.S. healthcare system has been under-resourced for a long time, but I did not know why until I read the essay on healthcare in the 1619 Project. It made me realize that access to affordable, reliable, and effective healthcare has been a struggle for a large majority of Americans, but specifically Black Americans, due to systemic restrictions purposely introduced after emancipation. The more I read about these issues, especially the Tuskegee syphilis study, the more I understood why there's such deep distrust of medical institutions. It's difficult to picture the extent to which the history of abuse and neglect still influences generations. This bias provides logic as to why some family members, including myself, were not willing to take the vaccine in the middle of the COVID pandemic. It was not the vaccine that worried them, but an abiding distrust that has survived through family history.